Let me now turn to our work to satisfy the value of dignity. It is no secret that our health services and health needs in Nairobi are complex. Nairobi is not just the largest and most densely populated counties in the country. Nairobi meets the medical needs of Kenyans from other counties in the ordinary course of things, and it is where the most difficult and complex cases are heard and handled. I am proud to say that we are meeting our responsibilities in spite of that complexity. And I must thank our CEC, Susan Silantoi, our chief officers, Musiria, Dr. Mushoki, and Tom Nyakaba, for the work that they have been doing, of course, together with our Committee of Health led by Honorable Morris. When you came in, ladies and gentlemen, and I must thank you, we changed the governance structure of our level 5 facilities based on the report of the Task Force on Health Reforms that we commissioned within the first 60 days of taking office. We appointed professional chief executive officers and replaced all of the boards of the level 5 hospitals. The CEOs ensure a new level of professionalism in day-to-day operations while leading the strategic development initiatives required for longer-term success. In consequence, we have quite a number of wins to report. I want to start with Mama Lucy Kibaki Hospital, which recently opened the first public eye hospital in Kenya, the Mama Lucy Kibaki Eye Hospital in Umoja 2 Annex, where every day about 300 patients are seen and more than 20 procedures are performed daily. Honorable Shadrach Mashanje will confirm that that is actually what is happening on the ground, isn't it? Amani story. It is. The needs that this hospital meets are pressing. Honorable members, and I would invite you to visit. We have seen old men and women present with cataracts. We had children blinded by eye infections left untreated. You all know, all of you who are here, that sight is the most prized of our senses. Its loss or damage is life-changing. In restoring sight, we transform lives. Recently, and this story is very heartwarming for me, a 90-year-old man had surgery there. This man had been blind for 50 years. He refused to leave the hospital because after years of not being able to see, he thought that if he left, he will stop seeing. We had to encourage him that he will still see, even as he left the hospital. It was so heartwarming seeing him exchange jokes with his son, asking his son, "So this is how you look after 51 years. I thought you were more handsome." It was really heartwarming. That story is shared with many, many families. In that hospital, we are manufacturing spectacles. In that hospital, surgeries are performed. The blind are seeing. Thank you to the County Assembly of Nairobi. Mr. Speaker, sir, honorable members, we have also established the Mama Lucy Kibaki Intensive Care Unit, the first ICU facility to be established in this country since the advent of devolution. We have established a blood bank that was in the manifesto. We have established a renal unit. Anyone who has borne the burden of mistreatments or avoidable harm simply because a bed in a renal unit or an ICU was unavailable will appreciate what a step this is for the people of Nairobi. We have brought other services to that facility. We have opened an orthopedic and trauma center, which consists of 2 theaters and a 20-bed capacity ward. We have a new reconstructive surgery center, and we've also opened an integrated mother-child healthcare center, which offers breast and cervical cancer diagnosis and treatment, amongst other services. Last year, we installed a new neonatal ICU at Mbagathi Hospital. As I said at the time, it was a project we prioritized because we had seen the dire consequences of delay and congestion in treating newborn babies, especially those born before their time, the premature births. The new unit at Mbagathi is the latest public ICU in Nairobi. It comes complete with 4 high-need beds, 20 incubators, and highly technical and professional staff. In fact, one of our doctors there, Dr. Manyasi, was part of the team that performed the first intrauterine blood transfusion in the history of this country at Kenyatta National Hospital. We are proud of Dr. Manyasi and the entire team that is there, led by the CEO, Alex Irungu. The CEO of Mama Lucy is Alfred Wekesa. The CEO of Pumwani is Christine Kitusho. The CEO of Mutuini Hospital, soon to be actually named Mama Rachel Ruto Hospital, is Dr. Obwanda. But I can pledge that we'll open more so that Nairobi's mothers and their children live lives of dignity. In particular, the NICU, or the neonatal ICU, at Pumwani Hospital will be completed this financial year that ends in June this year. Thank you, Chairman Health, for the support you've accorded the executive in performance of their duties. And I must thank the committee. When you had visitors recently, you acted like Nairobi County. May God bless you. Ladies and gentlemen, I have amazing news. We are very close, in fact hours, to formally completing the agreements of reversion of Mama Margaret Uhuru Hospital in Kariobangi North. I know Mheshimiwa Matach and my best friend Munuve compete on whose ward it is in. Yeah, Mheshimiwa Matach says Korogosho at the fence. Mheshimiwa Munuve says it's Kariobangi North. I will give the final determination. But we are finally at the last stage of having this hospital come back to the county as a level 5 general hospital. This facility, with 400 beds, double the size of Mama Lucy Hospital, will serve a catchment area of 2 million people across the area it is in. It will ease pressure on Mama Lucy Kibaki Hospital. Our predecessors, those who've been here before us, the journey that started in 1989 with the Nyayo wards, a journey that had several false starts, several misses, a journey that Governor Evans Kidero tried, but it faltered. The next administration tried, but it faltered, is about to culminate in the coming few hours. Members, this is indeed a milestone for the people of Nairobi. Gone will be the days of beds being shared by our mothers and our sisters at Mama Lucy Kibaki Hospital. Ladies and gentlemen, we're also progressively upgrading our level 4 hospitals, not least by strengthening the governance structures, to introduce new committees and boards. And members, I asked you for recommendations as well, for those who have a level 4 facility within your ward, in changing those structures, in introducing professional management, but in keeping with the national agenda of creating fully fledged primary care networks. Allow me to mention 2 more interventions in health before I move on to something else. You will remember, members, that we promised to equip and to resource and to fund 7,480 community health promoters with kits that they need to do their work and to pay them a monthly stipend. We have done so. Members, Nairobi County government, and this is a story very close to my heart because I fought for this when I was in the Senate. Nairobi County government was the first county government to introduce a stipend of 3,500 shillings to all of our community health promoters. Then we used to call them community health volunteers. And I'm glad that now the national government has also added 2,500 shillings. Now 7,300 of them are equipped with smartphones, community health kits, and every month, and I instructed my finance team, every month they receive their stipends, and I told them they must receive their stipends before I receive my salary. They are doing an amazing work in our communities. They have covered 750,000 households in the city who may not need to go to hospital but to manage certain conditions at home. Let us appreciate the community health promoters of Nairobi County.